So let's talk about the problems with the inner ear where you start to get vertigo or dizziness. So the first one is the BPPV, which is benign paroxysmal positional vertigo. You don't have to worry about the name. It's quite a common condition that's seen. And what happens is your semicircular canals have got hair inside, and the tip of these hairs have got some crystals, the calcium carbonate crystals attached to it. Sometimes these crystals will get released and go into the fluid in the semicircular canal, and that will stimulate the canals, similar to if, say, I was to move my head to one side. The crystal, even when I am stationary, the crystals will do that stimulation of will create the stimulation of the semicircular canals. So your brain will start to get a signal that your head is actually moving while it is, well, in reality it is stationary. So that can cause some dizziness. Now the second one is vestibular neuritis or neuronitis. So there is a nerve that is going from your vestibular system, vestibular apparatus, that is your semicircular canals plus a few more organs in that area. It goes up to the brain, and that is how the signals are taken up to the brain and then sent back into the ears. So what happens with vestibular neuronitis is there is a sudden onset of acute vertigo, and it can be with nausea and vomiting. It can be due to infection in this nerve that you get even when you're stationary, you start to get dizzy because this nerve is getting stimulated on its own. Now, usually when patients present with vestibular neuritis, they usually have a cold or a cough or a viral infection prior to that. So the next one is labyrinthitis. So the ear canal, when there is an inflammation in there, that's called a labyrinthitis. So this also usually has a history of cough, cold or fever before the vertigo symptoms come on. Now the fourth one that we're looking at is Meniere's disease. Sorry, I'm just referring to my notes here. Meniere's disease, this is basically, there's a pressure buildup within the semicircular canal. So you get a feeling of fullness in the ears. You know how when we are traveling and the aeroplane takes off and you feel a pressure build up in the ears and then your ears pop and you feel better? So there's like a constant buildup of pressure of the ears, and this can lead to a sudden vertigo that can last up to 24 hours, usually with nausea and vomiting. This can be quite debilitating actually, because it can cause hearing loss, it can cause tinnitus, that is a ringing in the ears. So these are the 4 conditions where you can get vertigo. Join my Facebook group where we discuss these topics in more details. The link is in the description below.